News Talk 580 1059 KMJ. Welcome to the Marc Kapetan Show. This is Attorney Marc Kapetan, your host. Today's show is brought to you by the Kapetan Brothers Law Firm. We've been serving the Central Valley since 1995. If you or anybody you know has been injured in an auto accident, a truck accident, or a motorcycle accident, give us a call at 559-498-8000. That's Monday through Friday, folks. 559-498-8000. We accept calls on the weekends, too. Kapetan Brothers, 559-498-8000. We are the Valley's law firm. Today's show is sponsored by Sherlock Realty. Sherlock Realty. If you are searching for a new home and need a clue, turn to my friend Victoria Sherlock from Sherlock Realty. She's like the Sherlock Holmes of real estate, we like to say, a super sleuth for finding your next home with nearly 20 years of real estate experience. Victoria will help you find the right home at the right price, or you may be looking to sell your current home at the best price. Either way, Sherlock Realty is your answer. Victoria Sherlock is a pro. Call 559-289-4669, 559-289-4669. Sherlock Realty, the clue to finding your next home. Someone asked me, is there ever a guest you would like to have back on the show? Not this guy, but no, I'm teasing. Wow. You may ask yourself, out of all the great guests on the show, why would I ask my next guest to return? Not because he isn't a great guy, but because he's my urologist. Why would I want my urologist to come back? That's right, my urologist. Kids, welcome, all you young people there, welcome to your future, because you're going to hear how horrible it's going to get. Someday, a few years down the road, you are going to have a guy or a lady probe you, poke you, like you could never imagine in your worst nightmares. I have said cuss words in this guy's office, the likes of which your mother would wash your mouth out with soap. And yet I still love the guy. I still love you. He's very professional, very gentle. He has a great bedside manner. I assure you he was not at the bedside when these violations occurred, but best of all, he is funny, witty, intelligent, and he's a great friend. Dr. Bill is nearly retired. He has been very successful, and he realizes that sometimes a serious medical subject has to be approached with some humor to encourage open discussion, right?
That makes sense. I didn't know I was retiring.
You're not retiring?
Oh, well, I didn't know,
I
but
just
go
figured,
ahead.
Well, nearly retired or nearly dead. So
Okay.
Okay. So today,
You've been talking to my wife. Yeah.
We're planning it right now. So today's show is going to include sexual material and potty humor and other jocularities, I like to say. So if you're uptight and you can't take it, turn the station to NPR, please. Okay. So please welcome back to the show for the first time ever, a returning guest, world-renowned urologist, Dr. William Schiff, or Dr. Bill, as we like to say. Welcome, Bill.
Wow. That is
You
lovely.
like that?
You forgot to have the kids leave the room. So thank you, Mark. Thank you, Marcella, for bringing me back.
That's great. Yeah, I appreciate it. Hey, you got a radio show, right?
I had radio shows.
Yeah.
I'm one of the. It's a podcast now.
Okay, because I was going to tell you, you want to speak into the mic, it'd be better.
Oh,
Okay.
geez.
Right
All
here.
right.
See?
Okay, I'm used to my overhead.
Okay. Oh, that's
So,
right.
yeah.
I'm sorry. You already complained about the way my microphone comes from down below and up instead of from above and down below.
That was a urologic joke. But yeah, no, it's podcasts. I'm having fun with it. Radio shows in the 90s. I had a couple of them, actually, but I'm doing podcasts now. Yeah.
By the way, so I used to call in regularly to that show that you had in the 90s because it started off a little bit slow. And we would call with different voices all the time saying, oh, there's this Dr. Schiff and blah. Yeah, so.
Yeah, I didn't have a lot of followers or a lot of call-in. So my parents at that point, let's see, in the 90s, 30, yeah, and they were in their 60s or so, right?
Yeah.
And so they could only dial. We had the dial-ups. They couldn't call in that quickly. So thank you.
So were they faking their voices also?
Yeah, my mom did a great Irish alcoholic. It was good.
Is your mom Irish? No.
No, of course not.
Yeah.
You know, do I look Irish? I got the map of Israel on my face. Okay.
The map of Israel. Really? Does that have a long... no, I'm not even going to go there. So All right,
there's nothing long about the Jews, okay?
All right, let's cut straight to it. Okay.
Okay.
Why? And this is a question from one of my family members. All right.
Okay.
Why do you guys wait until the very end to do the finger? Why don't you do it at the beginning? He says he goes, I can't stand having to sit there the whole time waiting for him to do the finger wave while he's trying to have a serious discussion.
No,
you would leave it for the very end.
It's a good point, because we used to do it at the beginning, but I got complaints from the neighbors because we would do it in the parking lot when the patients would come in, because it's tough parking, and we're pretty popular. So that's why we do it at the end.
I thought there was actually going to be a serious answer there.
Bring someone else in for the interview then.
Yeah. By the way, I understand your wife is coming over to make bread at my house.
That's what she says, yes.
No, that's what we're telling you.
Yeah.
She's making great sourdough bread, by the way.
She has, she loves cooking. She has taught our son how to cook, which is great. When he comes home to visit, I don't go anywhere else because there's constant food. The kitchen is crazy.
Is he going to go into urology? Your dad was in urology. You were in urology, or you still are, and your son? No,
no. My son's in business. He's up north in a big city, and he has his master's in business and working towards some other things going on that are good. He's happy with what he's doing right now. All right,
good for him. I appreciate it. All right, listen. The sexual revolution was in the 60s, and we're going to get into that a little bit. You almost could say that there's now a revolution, or at least I don't know, depending on your side, devolution for the people out there in KMJ land, of sexual assignment and sexual gender fluidity and all this kind of stuff. I'm going to have a ton of spam, by the way, from researching all this stuff over the last week. But I think it's a serious subject that needs to be talked about, and it's been in the news a lot. But I think people are finally starting to come out and say, it's great, we're respecting people's maybe wishes to be who they want to be, but now we're getting to the point to where it is medically, I think, dangerous, for lack of a better word. So tell me, tell me your thoughts initially, and then we'll get into some specifics.
All right. So I've made my living and made my name in this area of
sexual dysfunction,
sexual health for men and women, and that has changed very significantly over the last couple decades. And though decades ago I would be involved in hormonal management of transgender patients, and that was fun and exciting and interesting and very unusual, and just because there were not a lot of people that would come through our doors with these concerns.
And what do you mean you were involved? Were you actually?
I was treating patients hormonally, not surgical reassignments, and there were some very strict guidelines then about. And they were adults, they were not children. Mm-hmm. These were people who underwent years of self-study and about what they wanted to do, and then went to therapists and psychiatrists with guidelines that had to be followed before they even got to me.
Right.
Now this is a different world where we're seeing younger people who talk about this, and
it's almost on a whim.
Yeah, that's my concern. And though my area of expertise is not on transgender management, I see a lot of it. My background is psych. What I've done for the last few decades in my work is sexual health. But we're seeing people who decide one point that they are uncomfortable with their gender and then try to make some decisions based on that I don't think are healthy. We're seeing pathology in patients who are transgender. It's not to say that everyone who has made that choice has an underlying psychopathy, but there are issues, psychological issues, that on face value make sense. I mean, you talk about depression and anxiety, but you also talk about major psychiatric disorders that may be associated with transgender work.
But you're not trained in psychiatry, basically.
No, my background is psych as far as undergraduate work. I worked in psych units before medical school.
So what I'm saying is there starting to be a trend of let's just treat medically and let's focus away from the psychology of it, because we are now to a position in society that it's taboo to say that there's a psychological issue going on.
Oh, no, without question. What you're saying is we cannot offer an argument pro or con on any subject without having an adversarial relationship. We have lost our shit, I guess. Marcella will have to edit that out. But we have lost our thinking ability and our ability to have a conversation that may differ. Everything is antagonistic and adversarial. It is inappropriate, without question.
All right, we'll be right back with Dr. William Schiff from Urology Associates here in Fresno. Right after this. This is the Marc Kapetan Show on KMJ. It's News Talk 580 1059 KMJ. Welcome back to the Marc Kapetan Show. I'm going to pot this music down like I like to do on the second segment. Folks, if you have been injured in an auto accident, truck accident, motorcycle accident, if you have catastrophic injuries, if you have friends who have catastrophic injuries, brain injuries, things of that nature, do yourself a favor, do them a favor. Contact your local attorney. Contact the Kapetan brothers. We've done this for over 30 years each. My brother and I have done, Peter, I think 35 years. I've done this for 31 years. And we know what we're doing. It's a very difficult time. It's a very stressful time, and you don't know where to turn to. But the easiest thing to do is make a simple phone call. And I don't say that lightly as an advertising ploy. People don't know what to do. And if you just make a phone call, you could hear the relief in our clients' voices, Marcella, when you're done talking with them, because they realize, now they have some focus. They have someone maybe that's going to be on their side, and they're going to help them out. So call the Kapetan Brothers, 559-498-8000, Kapetan Brothers. We're the Valley's law firm. We are back on with Dr. William Schiff, Dr. Bill, as we like to say, an old buddy of mine, and a urologist at Urology Associates. We're talking about the sexual assignment revolution. I don't like to use that term because it makes it somewhat of a, I don't know, Bill. There's the latest news is Garth Brooks promises to sell beer at all bars, including Bud Light beers, and the conservatives in the country world is reeling because of this transgender issue. There was Rose Montoya, who is a transgender man to woman. I don't know what the proper terminology is, that bears her breasts on with her implants, his implants, however you want to put it, on the White House lawn. So now we not only have government and society accepting things as far as a person's choice and a person's feelings, etc. And I don't like to get very political, but this is, I got a medical guy here. But now we have the government basically advocating it, likely going to subsidize it by healthcare and taxes, etc. And is this a bad road that we're going down?
Well, I don't think it's unique to sexual issues. We had the same thing occur in mandates during COVID. That if, at least in this particular state, if as a physician, and I know as a urologist, I know nothing about COVID except two things. One, it can cause problems with erections, and two, it can cause issues with fertility, because that's what I do.
Really?
Yes, that's what I do every day. However, now we're mandated to have certain statements and cannot say anything negative against the government. This is different than I signed up for. This is certainly different than my father signed up for 100 years ago. And it makes zero sense. And
that's part of the question. It's changed the way that you practice. I was referencing the Hippocratic Oath when we were discussing things earlier. It's potentially going to be against the law for you to consult a patient against such surgery or recommend against it. It's going to potentially be against the law for you to refuse to treat it or to administer the hormonal therapy and stuff like that. Yet as a doctor, are you there caught in between that, the government potential mandates, and the fact that you think that people are potentially being damaged by this, psychologically and physically mutilated by it?
Well, there are a couple things. We know that in sexuality, at least when we look at women who grow up being straight, they may go to college and for some reason decide to expand their sexual menu in same-sex partnership. There's some transitions that occur, and those are psychological issues. We may want to experiment. We may be more sexual and sensual and decide that same-sex partners may be appropriate. When we get older, for women, it's time for us to get married, have a family. So I'm going to get back to my heterosexual relationship as the kids get out, and now I'm no longer interested in mating. I may go back to an interest in same-sex relationships. That's not abnormal. It's okay.
So you see the fluidity as something scientifically.
There are studies on women in same-sex relationships and how there is a fluid process. Not with everyone, but with some people. Now, let's take it to a situation where, as a child, I don't feel I'm the person in the right body. And I'm not mocking this. This has got to be a horrible issue for parents. It's got to be a very anxiety-provoking and scary issue for the child. You know, I'm not in the right body. There's something weird happening to me. But to act upon that concern or that dissonance in a way that is irreversible, and then have adults and government support that to a point of pushing it, is insane.
Insane.
It's absolutely insane.
Okay, so you're talking about fluidity, and I have no problems with this. That when and I'm assuming it has to do with maybe neurological and chemical, et cetera, that there's hormonal changes that occur at different times of life, or I don't know if it could be born out of an attraction to a person or a relationship that grows into more of a love relationship, that it becomes fluid. But there has to be a point to where the body is understanding the sexual side of the human condition, that the body has matured enough that it could go through this fluid sexual process. And the answer that you're trying to say is basically, as a child, you haven't reached that sexual maturity, so these feelings may not be based on sex. Would that be a right answer, that it wouldn't be based on the sexual condition of the body and the chemical and neurological changes that because it hasn't matured to that point yet?
Your question poses things that I haven't even got to yet, but you're correct. That we have data that my nephews and nieces would mock me about, saying, look, you're 16. Your brain hasn't developed yet. Talk to me when you're 24 or 26 about this.
Right.
And this is not about a transgender issue. It's about maturity. It's about making decisions. We know the science, the neuroscience tells us that our brain isn't fully capable of full development or making decisions on certain things when you're 24, 25, 26. I don't even understand, and it may be out of my ignorance.
Right.
I don't get someone 16, 17, 18 saying, I'm male to female, female to male, I want to change that. And we're just using basic structure. My whole life, in whether it's professionally or socially, is how I'm built. I have to see the craziness in the world, regardless, anything, and try to make sense of it in order for me to navigate. That's how I'm wired. Not good or bad, it's just how I'm wired. I don't get it. I don't get it when it comes to this issue of transgender. Now, I have patients 50, 60, 70. All right, I don't understand it, but they've developed a program that works for them. And at 50, they actually deserve to do what they want to do.
We are on with Dr. William Schiff, Dr. Bill Schiff, Urology Associates. He's a foremost
Foreign graduate. I thought you were going to say.
Foreign graduate, yeah, foremost expert on sexual dysfunction and urology. So we'll be right back after this on the Marc Kapetan Show. It's News Talk 580 1059 KMJ. Welcome back to the Marc Kapetan Show. Folks, you know the drill. If you've been arrested or cited for a criminal offense or in an accident, who do you call, Marcella?
The Kapetan brothers.
The Kapetan Brothers Law Firm. Bill, who do you call?
Kapetan Brothers.
Kapetan Brothers. Thank you, Bill.
Good.
Thank you, Dr. Bill. If you are in need of urological help, you call Dr. William Schiff from Urology and Associates. Bill, what's the number over there at Urology Associates?
Yeah, right.
No, seriously, do you know it?
Number 4.
No, you don't. 4. Really, you don't know your own number there.
We should find it. 321-2800.
Yeah, I think I have it written down here. Okay, 321-2800. Urology Associates. I want to thank our new sponsor, Sherlock Realty. Again, if you're looking for a new home or looking to sell your current home, call my friend Victoria Sherlock. We had dinner with Victoria last night at Cezanne. Ooh, what a great restaurant. Hey, by the way, let's pot this music down. That Cezanne is a great restaurant. Oh, my God. Thank you, Victoria, for dinner last night. Victoria Sherlock. CV Lux Magazine voted Victoria and Sherlock Realty their top realtor award for the second year in a row. So if you want the right home at the right price, call Victoria Sherlock at Sherlock Realty, 559-289-4669. That's Sherlock Realty, the clue to finding your next home. Have you been to Cezanne, by the way, Bill?
Several times. I love it. It's great.
Oh, it's great.
You got to get to the chef's table.
Oh, that. Yeah. Oh, really?
Yeah. It's really fine.
I'm gonna have to do that next time. Believe me, I don't have urology money. I have criminal defense money. Okay, I don't have urology money, Bill.
The criminal defense people are getting my money. So.
Are you? Exactly.
In fact, I was calling your office and I'm on an interview.
That's why you're going to vouch for us, Kapetan Brothers. No, okay. You've done this for how long now, by the way?
The show, centuries.
No. Oh, my Lord.
I joined my dad's practice in '88.
Dr. William, what was your dad's for? Jack. Dr. Jack.
J.J. Schiff.
I'm sure he's, well, I don't... I'm sure his digits have been in many of Fresno's patients.
This is a true story. He would tell me that he was right-handed. His right index finger was 1 inch longer than his left. Yeah, absolutely.
You're serious about that.
I'm dead serious.
Because you normally are joking, but you're serious about that.
Very true.
And your dad was proud about that.
Oh, are you kidding?
And so he used the right finger, right?
Badge of honor.
Oh my God! And just to be mean to the patients, he used the longer finger, right?
Why not?
Hey, let me ask you. Come on,
I'm here. Okay. Why not?
You have to have a sense of humor doing it. And folks, I know we're talking potty humor and stupid stuff, but I sit around the table when we're at dinner, and I'll look at people that I know, and there'll be a wink and a nod that, I may or may not have represented some of these people, accidents, things of that nature. Maybe they got a traffic ticket or maybe something worse than that, like that. And I laugh. But you sit there and you look at guys, and we've had, you know everything intimate about a person.
Yeah, a lot of times, that's an interesting point. And a lot of times I won't, people come up to me, say, "Hey, good to see you, Dr. Schiff," and I try to introduce them to my family. I won't remember their face. So I get yelled at.
When you say you don't remember their face, do you remember their private area?
No, but I do. So ultimately what happens is they pull their pants down. They,
come on now,
Bobby,
Bill.
Here's my wife, Patty, my son, Joey. Right.
Bill, I'm trying to be serious with you.
So am I.
That's ridiculous. Okay, but I mean, there's a bit of uncomfort with friends, relations, people you see out on the streets, or no?
No,
they just doctor.
For people who are my patients,
right.
No, because there's a trust. They come to me for a reason. People don't. I don't see people because they're my friends.
Right.
They come to me because they trust me.
Listen. I know you may sit there and people out there go, "Kapetan, that's an asinine question to ask." Okay, but part of when we come in, you are always very serious, but you're a very funny guy normally. We're joking around all the time, and you turn that off and you could be very serious, but there's got to be some sort of it's got to be difficult having these conversations, or at least trying to, how do you bring it out of the people, I guess, is the bigger question. Talking about sexual dysfunction and stuff like that, I'm assuming people are very shy to talk about that.
Oh, yes, but they're at my place for a reason. And you have to read your audience. Everyone is different. Some people who start out joking are joking because of discomfort.
That's a good way of putting it.
Some people are joking because they don't know what to say. So there's a whole science to this, and it has to do with tell me your story. It has to do with knowing your audience and what they're here for.
I have sort of similar experiences, because I tell people in the first 5 minutes of discussing something, a case with them, that I'm asking them questions that their own family member has never asked. And one of the big questions is, are you an alcoholic? You know, when we go through this long process.
You're not asking me now.
But we go through this long process of, and you know, I don't want them to admit they're alcoholic. I don't want them to deny they're alcoholic. I want them to tell me, I don't know, basically. Oh. But it's that question, and we could get into it one day, next time you come into my office with a DUI offense. But no, I'm teasing.
Oh, wait, how many do I have left before it gets serious?
We've long passed that. All right, let's get back into your job. You said you had.
Would you, for the record, would you say that I'm clean? I don't have a Dewey on me.
Oh my Lord! Okay, you have no Deweys. You've never been to my. Actually, you have never been to my office for a case or anything like that. So yeah, I appreciate it. You've had personal experiences with reassignment patients that, like you were talking on the first segment.
Yeah.
As a doctor, you started off in the 80s, and like you said, there were 70s, 80s. There was this trend of trying to help people that were having these issues, trying to find themselves, etc. And there still is that component of it. Have you completely gotten to the point to where, as a doctor, you're sitting there saying, the medical, and I don't know what the general medical field feels as far as this is concerned, and the percentage of doctors that are in favor or not in favor, but have you personally, has your opinion changed of, we went down the slippery slope and we may not be coming back from this thing? People are going through very, very dangerous medical procedures just to fulfill some sort of psychological feeling. As
Bill Schiff, private citizen, not related to UACC. At any rate, these are my words. It's not a slippery slope. It's that we've lost our minds. And there are things that I have the luxury of saying, no, I won't, I'm not comfortable. I turned down something today. An individual is a new patient who I was asked to do a non-reversible procedure.
Okay, right.
And so I'm not going to, a surgical procedure. No. For a whole bunch of reasons, and it's not a moral issue. It's just, does this person know what's going on? And that's the issue. Is there
do you fear? I mean, have you gotten to the point to where you go, I don't give a damn anymore, or do you fear that there's a backlash regarding your medical license and stuff like that, or at least the medical boards have gotten to the point to where they've bought into all this too, and therefore there's doctors out there that are doing things that they don't want to do, that they don't feel is proper?
I don't know if I'll ever get to a point where I don't give a damn, because I tread lightly on things that, and it's unusual for me to be public about this on a radio show that actually has a following. On my podcast, I know there's 6 people listening, and so I say what I want to say. But I have the specter of fear of, gee, what I do, will it be misinterpreted as a step away from my oath of being a doctor? So no, I'm very much aware of this, but I'm concerned.
Yeah, and what I mean is, have you gotten to the point to where you say, damn, you know, what people may think, or what the guidelines by the government may be? I have an opinion as a doctor who's done this for 30-something years, and therefore I'm going to stick with my decision over what the guidelines may be.
Yeah, I remove myself from the argument many times so I don't have to fight the government, and there's certain things I won't get involved in, and there's certain things that I'll say, I don't have an answer for you, and I'm not going to give you an answer that you want to hear, but I don't know what the right answer is. And I will say that skirting the issue, because I don't want to involve you with defending me to the government.
Well, I'll give you a discount if it happens, okay?
Oh, okay.
All right, thank you.
It adds up, though.
We'll be right back with Dr. William Schiff right after this. This is the Marc Kapetan Show on KMJ. It's News Talk 580 105.9 KMJ. I almost forgot the last number. 105.9 KMJ. Welcome back to the Marc Kapetan Show. Hey, folks, you guys know, listen, I'm going to pop this music down. Kapetan Brothers, 559-498-8000. If you've been in an accident, an auto accident, a truck accident, or a motorcycle accident, I want to get back to my buddy, Dr. William Schiff, Dr. Bill, as we like to say, with Urology Associates. Been practicing urology for 35, would you say 30-something years?
Somewhere around there, yeah.
Somewhere around there. Okay, let's get into what your real love is now, and that is Just the Tip America. This is your podcast. It's podcast TikTok. I don't even have a TikTok. You got a TikTok?
Well, I've got 100 people who are 20 years and younger working with me. So, yeah, they tell me what to do. So I'm a social media maven.
Just the Tip America. What got you on that?
Well, I lectured for years. I was contacted pre-COVID, a couple of years before COVID, to try to get a lecture company going with two other people who were non-physicians but used to be my front people all over the country, and they wanted to start a education program. We worked on that for a long time. COVID hit. We got stuck with how to do it virtually, and that deteriorated into let's just do podcasts. So we have Just the Tip America and Sexual Healing podcasts out there that with all sorts of a whole different spectrum of media on TikTok and what's the other one?
Twitter or one of those things? Or
all
what?
of them.
Yeah, Instagram, yeah. Sexual Healing's the other one?
Sexual Healing podcast. And it talks about, and it's fun because it's people talking who know what's going on, who've been in the industry, a physician and two people who worked in the industry that developed penile implants. And
that was one of your specialties too,
yeah.
Right? Yeah. Yeah, I mean, folks, listen, if you are suffering from some sort of sexual dysfunction, it's believe me, you think you may be alone, but you're not. And Dr. Bill Schiff, William Schiff, my guest, is the foremost expert in the United States, or one of the foremost experts, I'd like to say the foremost expert, on sexual dysfunction and penile implants and all the alternatives.
Well, you're too kind, Mark, and so I don't get in trouble with the medical board. I'm going to say I'm the expert in this room. How's that?
Okay, that sounds good for me. Is it okay? When it comes to the invasiveness of a penile implant compared to a sexual reassignment surgery, you are fixing a problem that is, I mean, how would you sort of compare those two? Well,
there's no comparison, first of all. So when we talk about sexual health, let's step away from the transgender issue because I'm not the expert. I'm concerned about the politicization, is that a word?
I think something like that. Of transgender work. But when it comes to sexual health, a very important issue and something that is everywhere, and you're right, we're not alone. The older we get, 40, 50, 60% of us men will have sexual dysfunction for a whole bunch of reasons. And Marcella, to your point off air, is that women have similar issues. Very important, and there can be a combination of physical and psychological issues, and they both have to be addressed. And be done safely. One of the questions we had, and we were talking about it off air with Marcella, one of the listener questions basically was, how come the men get all the attention? And I don't mean that lightly, that the men get all the attention and the women, when it comes to sexual dysfunction and things, seem to have no one to turn to. But I'm assuming that's just a matter of publicizing it better for these women. Well, part of it is there's no money in it to the pharmaceutical companies. There's just no money in it because men complain women suffered in silence for years because it was not appropriate for a woman to be sexual. Oh, see, I never thought of that.
You got to think about that because there's moral issues, psychosocial issues,
because
family
a man's
issues.
a stud and a woman is loose, basically, or something like that.
However we want to label it. But yeah, that's absolutely correct. So there was a social label for someone who says, hey, I want to be sexual. And now we are comfortable. The public is saying, you know what? Men and women can be sexual beings, and that's okay. Oh, so a lot of it is the population who complained about it was not vocal enough to support billions of dollars for the pharmaceuticals to put in research.
So speak up, basically.
Yeah.
I saw an ad. Listen, like I said, while I'm researching this, I'm getting ads and ads. I saw an ad that, and I'm assuming you don't like this. There's a the little blue pill ad that now you don't have to pay hundreds of dollars to Walmart and stuff. You could pay 87 cents a pill by texting some doctor, and he texts you back.
Right. So the web doctors, whatever that nomenclature is going to be, someone on the internet or someone virtually is going to take care of your problem. And it really minimizes the importance and the value of sexual health because it's not a pharmaceutical issue.
Right.
There is a place for this. I can tell you that most people who come to me and say they want an implant end up not having an implant for a variety of reasons, but usually we can find something else to address it, fix their medical problems, fix their psychosocial problems, work with a therapist, lose weight, take care of their
lose
diabetes.
weight. You said even smoking, all those kind of things can contribute.
Smoking is a killer. Smoking is very cool,
right?
And it got me action in college, but it gives me impotence when I'm older.
Right. Thank you for acknowledging that too. I'm not saying it's true or not true. I'm saying it's nice that you could say things to this public out here that's sitting there going, geez, I have a hard time saying stuff like that. It's just part of the conversation. But you, from what I remember, was not in favor of taking medication, the little blue pill and stuff like that.
No, I think that I don't know when we had that conversation. However,
thank you.
However, it's not for everyone. We have normalized medication because it's a quick fix.
Right.
What I'm not in favor is not taking care of your health, not quitting smoking, not drinking, and do all that.
And then take
a pill. One, it doesn't work, and two, it's dangerous.
Yeah. So it was basically a prioritizing of
what needs to be fixed.
Yeah, what needs to be fixed.
And by the way, I smoke and drink but don't take the pill. So
yes, we're going out right after. We're going to smoke and drink right after this. Yeah. Okay, you got a problem with plane seats and asking passengers to move on planes. What's that all about? You wrote down some topics you wanted to talk about.
Marcella, is that you, or is that for your guest next week? Oh, you know what I was talking about?
No, what?
And it came out, there was a conversation of why did I want to get into podcasts and social media to talk about the stuff that pisses me off.
Right.
The stuff that doesn't, where are we as a society where it's okay to be so intrusive to say, because I choose to, I want you to move your seat so I can be accommodated.
That's what that was about.
Yeah,
I
was angry. Excuse me.
You don't like the deterioration of San Francisco and the exodus from California. I'm going to San Francisco by the way with Frank Arnold and his wife.
I guess I wasn't invited because I'll be home this weekend working out.
No,
but here's the deal with this. It speaks to, and it all rolls into the same, that we have changed dramatically as a society.
Right.
We have changed our priorities where it's okay to, as long as we steal less than $1,000 worth of goods, we're okay.
Right.
It doesn't make sense.
Well, no, you got 1 minute. No, that finger was not showing you that I was going to give you the finger wave. It means we have 1 minute. So go ahead.
Oh, so I'm not getting a blood test?
No, go ahead.
No, I mean, these are the things that I can talk about in my podcast with impunity. It doesn't make sense. I don't understand. I get aggravated by this on why we've allowed these social changes to occur without repercussions.
Okay,
end of story.
If you want to listen to an angry urologist, go to Just the Tip America. If you need a great urologist, and I mean great, folks, go to Urology Associates and sign up with Dr. William Schiff. Thanks for being my guest this week.
The angry old Jew. Thank you.
I didn't say it. You said it. All right. We'll be right back. We'll be back next week, actually. Stay tuned for the restaurant tours after this. This is the Marc Kapetan Show on KMJ.